Hi, it's Callum. This is a lightning quick video of thyroid. Thyroid is an uncommon specimen. You won't see it very frequently, and it's a really difficult area. Thyroid pathology is a really difficult area. It's difficult because we don't see it very often, and it's difficult because it's difficult. So we'll just quickly go through thyroid at a really basic level because that's all you'll need for now. So this is thyroid. This is a section of thyroid. You can see the blue ink around the surface because that's how we treat these specimens when we ink them before we cut them, so that we have a good idea of the surgical margin. Because obviously, if you ink a specimen before you cut it, the ink is on the surface. So if you see the ink on the slide, then that means that that is the surgical margin. We use ink in a lot of different circumstances, but on thyroid, we ink the whole specimen. So there's blue ink all the way around the surface. Inside that is all thyroid. Thyroid is an endocrine gland which secretes two main hormones. We've got the main substance of the thyroid produces T3 and T4, and also there are cells which secrete calcitonin, which regulates or lowers blood calcium levels. So this is an encapsulated organ. So they've got a thin capsule that runs right around the surface, a thin fibrous capsule, lots of blood vessels, and the main substance of the gland is made up of the thyroid follicles, which are structures which are lined by epithelium and contain colloid, which is the secretory material. There is a thin fibrous band that runs right around the thyroid, and then strands of this fibrous collagenous material run through the thyroid as kind of collagenous septae that divide the thyroid into different lobules. That's really all there is to say. We'll just zoom in to give you a closer look. These are the thyroid follicles lined by a simple cuboidal epithelium, which secretes this colloid, which is the pink stuff you can see in the center. Between these thyroid follicles, there are collections of C cells, which are because these are the thyroid cells of the thyroid follicle. Thyroid follicular cells are responsible for T3 and T4 production. The C cells are responsible for calcitonin production, and they've got pale granular cytoplasm. That may be one there. I'm not sure. It's quite difficult to identify them on an H&E section, and we don't generally need to either. So that's a quick run through thyroid, and I think that's all you'll need to know for now. So if we go quickly on to the next video, I'll speak to you soon.